The Prime Minister has today said that the NHS has never been better prepared for winter than it was this season, and that the cancellation of thousands of operations was all part of the plan. But is that how those working on the front line in our hospitals feel in the face of increasing pressure on resources? Well, let's speak to one of them. Joining us from Newcastle is A&E Doctor Adrian Harrop. Adrian, very good afternoon to you. Well, let's start with that central claim by the Prime Minister. Never better prepared than this season. What do you make of that?
The way I would describe that is misleading, disingenuous nonsense. The system that I've been working in recent days and weeks seems under-resourced, underfunded, understaffed, and is in no sense a prepared or adequate system to meet the needs of the population who require it.
How much of the blame for that, though, Adrian, should rest on the shoulders of the Prime Minister, the Health Secretary, rather than, for example, the bosses of your NHS Trust?
The bosses of my trust in particular, I've seen firsthand, are doing absolutely everything they can to make the resources available to them work, and to use the staff and the ward spaces, the beds and whatever other resources at their disposal. They're doing their absolute utmost to make them work. The problem is that year on year, the amount of money, which is the resource we get from the government, that amount of money in real terms has become less and less and less in the face of a growing, ageing population with increasingly complicated medical need, who put increasing pressure on an already overstretched service. To describe it in any other terms is, like I said, misleading and disingenuous.
Not to mention the year-on-year increase in the cost of drugs as well. I mean, Adrian, in terms of what you've seen working at the coalface, I mean, just how bad has it got in your A&E department? What have you seen?
It's become utterly appalling and shocking, the type of care that we're able to offer people. In real terms, it means that we're not able to accept any more patients into our trust. I've offered a number of commentaries on this issue over the last few days, and it has got to a point where my department has become so overstretched that I am in a position where I am unable to accept a single extra patient into my department, not a single extra one. We've had patients collapsing onto the front desk of our A&E unit, saying that they've been reporting to the ambulance service over a period of hours that they've been having increasing difficulty with their breathing. They've collapsed into the department and needed to be rushed immediately to theatre for life-saving interventions. These people, if they hadn't have scrambled to get to the hospital themselves, if they hadn't have been driven up there themselves, they would have died. And this is just in my hospital. I'm hearing examples of things happening in a very, very similar way in units across the country. You know, and I'm sure you've heard many accounts of ambulances being delayed for several hours, being called out to people with heart attacks who have subsequently died whilst waiting for ambulances. And in my view, for that to be happening in one of the wealthiest nations in the world is entirely indefensible, and the responsibility for that sits squarely on the shoulders of Theresa May, the Prime Minister. She is ultimately the responsible person for this issue.
Adrian, is it because of those deaths, because of the unnecessary pain that people are having to endure, that doctors like yourself, who in previous years, when the winter crisis came along, were pretty stoic about it, got on and got the job done to the best of your ability? This year, we're seeing, as we just have from yourself, a lot of very personal anger and actually a political position being taken by doctors, which we haven't necessarily seen so often in the past.
The time for stoicism and for the stiff upper lip is over. The time for coping with this system the best we can is over. We can't do this any longer. We have struggled and managed to piece it together for years upon years upon years, and we're now reaching a position where we're not able to do that anymore. In previous years, having been a doctor for a number of years now, we've been able to piece it together and to just about manage. We're not just about managing anymore. We can't just keep calm and carry on anymore. We can't do it because we simply don't have any more to offer. We can't do any more. And it's up to people to stand up and tell it how it is. It's up to people to put themselves on the line and to put their jobs at risk, to stand up and say, you know what, I'm not going to stand for this anymore because this is indefensible and unacceptable and shouldn't be tolerated.
Indeed. Dr. Adrian Harrop, many thanks for joining us. We appreciate it.
Thank you.